Hello everyone, and welcome to today's webinar, the second and final webinar in our series entitled Minimum Floor Price Laws, an Emerging Strategy to Reduce Tobacco-Related Socioeconomic Inequities. We are excited that you are all able to join us today. My name is Derek Carr, and I'm an attorney at ChangeLab Solutions, and I'll be serving as the moderator and presenting on today's webinar. I'd like to start with a few housekeeping announcements. This webinar is being recorded and will be available for download from our website in about a week. Also, all participant lines have been muted. If you have a question for one of our presenters, please feel free to type your questions into the chat box on the lower left corner of the screen. We will try to answer as many questions as we can during the Q&A portion of the webinar. If we run out of time and haven't answered all of the questions that we receive, we will contact you via email with a response to your question. ChangeLab Solutions works across the nation to advance equitable laws and policies that ensure healthy lives for all. We prioritize communities whose residents are at highest risk for poor health, and our interdisciplinary team of lawyers, planners, policy analysts, and more work with neighborhoods, cities, and states to create thriving environments. And just as a disclaimer, ChangeLab Solutions does not provide legal advice or enter into attorney-client relationships. This presentation is for informational purposes only. Today's webinar will consist of two presentations followed by a question and answer session. As I mentioned, I'm an attorney at ChangeLab Solutions and help to lead our retail-focused tobacco control work. I'll be presenting first and giving kind of an overall overview of the subject. Second is Dr. Shelley Golden. Shelley Golden is an assistant professor in the Department of Health Behavior at the School of Public Health at the University of North Carolina at Chapel Hill and a member of the UNC Lineberger Comprehensive Cancer Center. Her research focuses on the political and area-level conditions in which individuals and policymakers make decisions that impact population health. Most of her current work focuses on tobacco product price policies, especially those implemented at the state and local level, and other aspects of the tobacco retail environment. Dr. Golden received her Bachelor's of Science in Biology from Yale University and her Master's of Public Health in Health Behavior and Health Education, as well as her doctorate degree in Public Policy from the University of North Carolina at Chapel Hill. In the first half of today's webinar, I'll recap the key themes and takeaways from part one of this webinar series, including why we're focused on tobacco pricing policies, the type of pricing policies, and the legal public health and equity policy considerations. I'll then take a deeper dive into some of the more nuanced policy considerations, such as addressing e-cigarettes and online sales, as well as taking a closer look at New York City's innovative minimum pricing law. Finally, I'll highlight a couple exciting new pricing resources that ChangeLab Solutions developed in partnership with Counter Tobacco. So why should we focus on tobacco product prices? Those of you who've done store surveys can attest to the widespread availability of cheap tobacco products. Surveys show that nearly 90% of tobacco retailers in California sell Swisher Sweets for less than $1. And we know that price discounts are core to Big Tobacco's playbook. Price discounts are the tobacco industry's single largest marketing expenditure, accounting for over 80% of their spending on all marketing and advertising in 2016. That includes $380 million on coupons for consumers and close to $8 billion on discounts and promotional allowances for retailers and wholesalers. And they also engage in the predatory targeting of underserved communities with these promotions and discounts. Studies show that in communities with higher proportions of Black high school students, menthol prices are lower and menthol advertising is more prevalent. And while pricing strategies are effective at reducing tobacco use and related harm across all populations, the evidence is clear that pricing policies can produce outsized benefits for many priority populations. That is, these policies produce greater reductions in tobacco use and related harm among many priority populations compared to the reductions across the population as a whole. And we don't just have to rely on studies either. Evaluations of tax increases and other pricing-related interventions prove that these policies work. Up until relatively recently, tobacco pricing policies occurred almost entirely at the state and federal level, and these policies generally took two main forms. The first is what's referred to as minimum markup laws. These laws require products to be priced at a certain percentage above the wholesale cost, and although about 25 states have some form of these markup laws, they're not really designed to protect public health. The evidence on their efficacy is mixed, and they're really difficult to enforce. On the other hand, excise taxes are the gold standard for increasing the cost of tobacco products. Every state and the federal government imposes tobacco excise taxes, and they provide critical funding for government services and tobacco control efforts. Unfortunately, though, California state law preempts, that is, prohibits, local governments from enacting local tobacco taxes. So the only way to increase tobacco taxes in California is at the state level. But of course, that's not the end of the story. There's plenty we can do at the local level, and these revolve around three core policies. First, establishing minimum floor prices beneath which no product may be sold. Second, prohibiting the redemption of coupons, discounts, and promotions. And third, establishing minimum package sizes. And it's also important to consider these policies as puzzle pieces that sort of all fit together to accomplish a larger task. They fill different gaps and protect against different industry tactics. So although each can be enacted on their own and will certainly have an important impact, this is truly a case where the full package is greater than the sum of its parts. So what are some of the equity, legal, and public health considerations to keep in mind when pursuing or enforcing these policies? From an equity perspective, it's important that we acknowledge and own that tobacco pricing policies are regressive, meaning that low to moderate income individuals will pay a higher percentage of their income towards increased prices than will high income individuals. This can impose a significant financial burden on low income smokers, and to the extent that low income smokers continue to smoke, higher tobacco prices decrease their purchasing power for other goods and services needed for their daily lives. However, any conversation about regressivity should frame the issue in the broader equity context of tobacco use. That is, framing it around the tobacco industry's consistent and pernicious targeting of its products disproportionately to underserved communities and youth. This contributes to tobacco-related harm being experienced disproportionately or regressively by these communities. And because increasing the price of tobacco products has been shown to have significant effects on consumption, they'll provide disproportionate health benefits to lower income communities. And of course, as with all policies, we must remain mindful that they're enforced equitably. This includes considering things like people's ability to pay fines, the impact of a person's immigration status, and the broader context of the current and historical targeting of many communities by police. Policies, of course, must be enforced rigorously, but it's imperative that we ensure that enforcement doesn't create new inequities or exacerbate existing inequities. Communities also need to be careful to steer clear of the First Amendment when designing tobacco pricing policies. The key thing to remember here is to focus on prohibiting the redemption of coupons and discounts rather than focusing on distribution. And finally, with minimum price policies, you want to make sure that your policies include language to automatically adjust the minimum price annually based on inflation. This ensures that the effectiveness of the policy doesn't diminish over time. So one of the most common questions we receive is how to go about applying minimum price policies to electronic smoking devices. And there are a lot of challenges to doing this. For one, the variation in product types makes it really difficult to determine what element to apply the minimum price to. For example, do you apply the minimum price to the device itself or to the e-liquid used within it? And if you're applying the minimum price to the e-liquid, do you set it based on the total volume of the liquid or on the nicotine content? And these questions are really important to consider because of potential unintended consequences. So if you consider again setting the minimum price based on the e-liquid, if you base the minimum price on total volume, you could encourage manufacturers to sell e-liquids with greater concentrations of nicotine. But if you base the minimum price on nicotine levels, you really need to figure out how you're going to enforce that policy. That's not always known. But again, all is not lost. Although no jurisdictions have done so yet, one potential strategy is to focus on the most commonly used electronic smoking devices, especially among youth, which are pod-based devices like Juul. That's because these pods provide really discrete units for calculating the minimum price, and jurisdictions can also consider restricting the sale of products with nicotine concentrations above a specified percentage to help prevent the sort of unintended consequences I mentioned a moment ago. It's also important to keep in mind that other pricing policies like prohibiting the redemption of coupons, discounts, and promotions generally apply to electronic smoking devices and can complement a minimum price policy. This slide shows some of the other common considerations when enacting minimum floor prices and tobacco pricing policies more generally. The issue of online sales is something that's coming up with increasing frequency, and it's also a tough issue to tackle at the local level. This is because although cities and counties generally have the authority to regulate sales occurring within their jurisdiction, it's much more difficult for them to take enforcement action against retailers located outside their jurisdiction. San Francisco recently proposed restrictions on the online sale of electronic smoking devices, so we'll be keeping a close eye to see if their efforts can provide a model for other jurisdictions. Next is product substitution. We know from decades of research on tobacco taxes that if you increase the price of one product, consumers will often switch to a similar but less expensive product. This occurred with flavored cigarettes as well, with tobacco companies shifting to flavored little cigars following the federal ban on flavored cigarettes in 2010. The important takeaway here is that local tobacco pricing policies should ensure that the policy covers the full array of products to minimize this potential for product substitution. It's also really important to provide increased cessation services, particularly among low-income populations that will be disproportionately affected by price increases. This will help to counter some of the regressivity arguments that we discussed previously. Next is retailer support, and this has two different meanings in this context. First, being that retailers can actually be a key ally in supporting minimum price policies because unlike taxes, they get to keep any additional revenue that they earn from the increased prices. So it's a win-win for both public health and for the businesses. Second, jurisdictions should also consider offering support to smaller retailers that are looking to shift their business model away from tobacco as a result of new tobacco control policies. This can include things like healthy retail programs and fee discounts. And finally, one of the most common critiques of local tobacco control policies generally is that people will simply go to a neighboring jurisdiction to purchase that product. Although research doesn't really bear this out in practice, it doesn't actually happen, advocates can still counter this narrative by encouraging neighboring jurisdictions to enact similar policies. I won't cover this slide in depth, but I wanted to provide a snapshot of California cities and counties with minimum price policies. And I will also note that 3 of these jurisdictions, San Leandro, the city of Alameda, and Albany, are all located in Alameda County. And more jurisdictions both within and outside Alameda County are actively considering such policies. So this is really, Alameda provides a really great example of what I was talking about a moment ago of trying to get neighboring cities to adopt similar policies. New York City also provides a great study on the evolution of minimum price policies. Although their original policy was more limited, primarily addressing cigarettes, they recently expanded their policy to include nearly all tobacco products with the exception of electronic smoking devices. And this expanded policy included a couple really important innovations. First, the law established minimum package sizes based on weight for smokeless tobacco, snuff, shisha, and loose tobacco, because prior to New York City's law, minimum pack size requirements were generally limited to cigarettes, little cigars, and cigars. Second, rather than setting a single minimum floor price, New York City law specifies a baseline floor price and then an additional minimum price based on the quantity of product being sold. So you can look at cigars and smokeless tobacco as an example. For cigars, Individual cigars must cost at least $8, but that minimum price increases by $1.75 for each additional cigar in a package. Similarly, smokeless tobacco is subject to a minimum pack size of 1.2 ounces and a minimum price of $8, but that minimum price increases by an additional $2 for each additional 0.3 of an ounce. This approach prevents tobacco companies from simply selling larger quantities at a low price as a loss leader and increases the impact of minimum price policy, but it is a little bit more challenging for jurisdictions to enforce. And before turning things over to Shelley, I want to highlight just a few resources. The first is ChangeLab Solutions Comprehensive Tobacco Retailer Licensing Model Ordinance. This model ordinance includes language for all 3 of the pricing policies I've covered today, and it's designed specifically for California cities and counties. The next 2 resources are a new fact sheet and infographic that we recently developed in partnership with Counter Tobacco. The resources cover the rationale for tobacco pricing policies, the different policy types, relevant considerations, and also other available resources. And the infographic in particular is really well suited to provide to community members or policymakers that might not have time to read a more lengthy document. And finally, although not specific to tobacco control, I also wanted to flag something that might be of interest, which is our recently released Health Equity Tool, a blueprint for change makers achieving health equity through law and policy. This new resource presents legal strategies and best practices to help policymakers, practitioners, and communities improve health outcomes. So with that, I thank you, and I will turn things over to Shelley.
Great. Thank you, Derek. I think that provides a great setting for what I'm going to talk about now. Derek introduced floor price options in general. I'll do a little bit more of that in terms of how we think about them operating within our pricing market. And then I'm going to talk a little bit about a tool that we've been developing in conjunction with the California Tobacco Control Program and ChangeLab to actually try to project the likely effects of minimum floor price laws in local jurisdictions. So Derek talked about a lot of the reasons why we might raise tobacco prices, and particularly talked about how the tobacco companies use prices to get people to use their products. And I just want to note here briefly that the scientific research suggests that changing tobacco prices affects a lot of different outcomes, from initiation and actual use, successful cessation, and then the factors down the line that are relevant for that are the sequelae of tobacco use, like the various health problems and deaths and the healthcare costs associated with that. And then about midway down that list, you'll see the question about reducing socioeconomic disparities in smoking, which Derek alluded to, and I'm going to talk about a little bit more as well. So as Derek mentions, our gold standard in pricing policies are excise taxes, and we are as we know, that does some great things for preventing youth initiation. It's also a source sometimes of revenues for governments. It might reduce disparities, and it doesn't provide any additional funding for retailers or for the tobacco industry, because the revenues from it come to the government. However, the excise taxes still leave open the possibility that the industry will take intentional action to offer discounts to offset those taxes, and so the policy doesn't target that. And excise taxes are applied equitably across all prices, and therefore leaving still relatively cheap products on the market. In addition, sometimes the industry actually shifts the burden of taxes in order to ensure that some products still remain very cheap. So a minimum floor price law, at its essence, is a law that sets a price below which a product cannot be sold. Now, as Derek mentioned, it's pretty hard to do this without some version of a minimum pack size requirement. And the general recommendations are also that it would be accompanied by a ban on the redemptions of promotions, because otherwise that might sort of offset this this policy altogether. So when I talk about minimum floor prices today, I'm really going to be talking about something that is based on all three of those things put together. We know that one of the reasons that we might think about complements to excise taxes is that different price policies might work differently. So in this visual here, I sort of have a simplistic notion of what a tobacco market might look like, where you have discount cigarettes and you have premium cigarettes. So sort of within a different, I'm going to talk about cigarettes in general at the moment here, but where you have sort of the cheaper brands on one side and the more expensive brands on the other. But then even within those, you have some variation, due to whether it's discount cigarettes. I'm sorry, I lost track of my. Within each tier, people pay different amounts. That's what I'm trying to say. And maybe because they're using coupons or because of particular retailers offering various discounts. So the vertical part shows sort of this difference within a particular price tier in pricing, whereas the horizontal part sort of shows the spectrum of different types of products that might be available on the market. So when we think about excise taxes, what we think about happening is we sort of raise the price on all of those products sort of by a certain amount. So now this blue section might show, okay, that entire pricing section might go up by a certain amount. On the other hand, if we were to start over again and think about floor prices, what they really do is sort of cut off price at a particular level. They might, even if set high enough, eliminate discount products altogether. And so they really sort of operate differently and are going to target different products within the tobacco market than an excise tax would. Now we know that California recently increased their cigarette taxes by $2. If on top of that a local community then is able to institute a floor price, what you might see is sort of a market that ends up looking like this. So you've sort of raised all prices and then also cut off some of the cheapest prices for products out there. So if you think about this all together, then as I noted, taxes have several benefits. Floor prices have different benefits. So they're still useful for preventing consumption and initiation. They do not raise money for government, though as Derek noted, they may provide some benefits to retailers, and they do guard against discounts, and they focus on the cheapest cigarettes. And of course, if we think about the two policies as complementary, then we get a lot of benefits from both. So we did we sort of explored some of these hypotheses in a national study where we looked at whether or not we thought floor price laws implemented at the state level would reduce consumption and reduce socioeconomic disparities. So this slide shows the results of that national projection study, in which we used data from the Tobacco Use Supplement to project the impact of different state floor prices. And we found that setting a floor price to sort of the average price that's reported by consumers within a given state, increased prices and reduced cigarette consumption for both lower and higher income smokers, but the change was greater for lower income smokers. And then we looked at different options for floor prices. So the middle here is that floor price set at the average, as I indicated, but as you actually set floor prices even higher, this disparity by income and daily cigarette consumption shrunk even further. And so with that sort of background, we then decided to work with both ChangeLab and CTCP to think about whether or not we could do something sort of very specific for California. As Derek mentioned, many of the jurisdictions are considering floor price laws, And with very few floor prices actually implemented in other places in the country, we have very limited actual empirical data that can be used to analyze sort of how the changes that we might expect to happen. So we wanted to build a tool that might be useful for advocates in thinking about sort of projecting what might occur with different floor price options. I'm going to be talking from this point forward entirely about cigarettes, but then we'll come back to other tobacco products toward the end. So how did we go about doing this? Well, the first thing we did was basically we created our own California population where we sort of created people who matched the demographics of the adult population of California, with the ultimate goal down the line of then being able to create a simulated population that might match the demographics of a particular jurisdiction of interest within California. And by matching, I'm talking about things like dimensions of gender, age, race and ethnicity, and poverty status. Then we use data from the California State Behavioral Risk Factor Surveillance System in order to sort of give all those people in our simulated population some initial baseline characteristics. In particular, we needed to figure out who smokes, how many cigarettes each of those smokers smokes, and what they pay for a pack of cigarettes before we do anything in terms of a policy. Each of these things in the California BRFSS data varies by demographic characteristics, and we use those demographic distributions of each in order to figure out who smokes, how many of the cigarettes they smoke, and how much they pay. Because we're using the 2014 to 2016 data, we then adjusted all of our prices to account for the $2 tax increase. And we've built into the system a way to adjust those prices for local markets using the Healthy Stores, Healthy Communities store audit price data as well. Then we want to think about what's a realistic floor price option for a given jurisdiction. And so in doing that, we look at sort of, we think about our simulated people in that population. We figure out what's sort of the average price that they're paying, and then we want to model a couple of different options. So we think about a few options that are kind of just below that average, a few that are just above it, and then several that are sort of more substantially above it where we think we might get the most response to a price change. Then we pretend to implement all of these different the different policy options at different times. We assume that once a given floor price is in place, individuals who were previously paying below that floor price would now pay that floor price level instead, so sort of the cheapest that they in theory could legally do. Those who were previously paying more, we'd let them keep paying more. They're probably buying premium brands or things like that that might be above the floor price, and we assume they continue to do so. That said, we do actually incorporate some amounts of policy avoidance. So while I just said we assume that everybody paying below now pays a floor price, we allow some people to find other ways around the policy and not do that in our modeling. And then we use the literature estimates of how people respond to changes in cigarette prices to figure out sort of how we think the price changes we're assuming would impact the way tobacco product use, cigarette use. So as I mentioned, the ultimate goal is to be able to do this on the local level, but I want to illustrate this approach using a model developed for the full state, so a statewide model. And then I'll briefly return to the notion of locality-specific modeling. All right, so first let's look at what we think might happen to prices. So you'll see here across the bottom, I have a variety of different floor price options, and also this pre-policy average price, sort of where prices start before the policies were, which are at $7.64, consistent with the slide that I'd shown earlier, which is actually from the state model. So we first estimate that if we just implemented a $7 floor price, so a little bit below that average, we would see a slight increase in prices due to the people who are paying below that, but not very much. If we increase that if we did a $7.50 floor price instead, we're going to go up a little bit more. And then as you can imagine, this sort of line curves upward as we raise prices even more. And in fact, you get a little bit more price increase for each 50-cent increment up as you go higher. Now this is the line that assumes no avoidance of the policy. If you decide that some people do, are likely to avoid, we sort of modeled out a kind of lower avoidance and a higher avoidance condition. And what I just want you to take away from this is that, of course, once people are able to avoid the policy, it's going to have less of an impact. But the sort of difference in impact, even when we put in some avoidance, isn't that much compared to the difference in sort of what happens to prices under these sort of higher floor price levels. So this is what we think would happen to prices. What about what we think would happen to actual smoking? So in our models, we started with a smoking prevalence of a little over 10% before the policy, and I'm going to show a graph that essentially looks at the same thing at each of these different floor price levels. What do we expect to happen to prevalence? So under the no avoidance condition, now we're going to see a sort of curved line bending downward. And again, less effective under other conditions of avoidance, but still relatively effective, even under our assumptions that 15% of the impacted population would avoid this policy. We project that a floor price of $8.50, so less than $1 above the current average price, might result in about 84,000 fewer smokers in California. We also modeled changes in cigarette consumption among the people that we assume that continue smoking in this policy. I'm not going to show you those results, but the curves look really similar to the way that they look for smoking prevalence. And then we also looked at how this might differ for different income groups, or as defined by poverty level, because we know that the sort of the effectiveness of the policy is one question, but what happens to disparities in smoking is a really critical issue for all pricing policies. And so similar to in our national study, we saw that we do project larger effects for people living below 250% of the federal poverty level compared to those living above. That said, I want to point out that there's a pretty strong disparity by poverty level currently in California. So when you sort of map this out, it's almost, because those two lines are so far away from each other, even though they are coming a little bit closer together, it's almost hard to see that because the prevalence levels are so far apart. So even though this is a policy that I think has potential for reducing socioeconomic disparities, it's probably not the only solution that needs to be implemented to do that. Now to return, I think our long-term vision is that we will be able to do this on a local jurisdiction level rather than at the state level. And we're really working at this point with the CTCP staff to get that implemented. So I just want to note that there's two reasons we might care about local jurisdictions. In addition, so for starters, county populations are really different from each other in terms of demographic characteristics like age and race and income status. And that, in part, is going to contribute to differences in tobacco use to begin with. Second, prices are different in different places. And so this is from the Healthy Stores and Healthy Communities audit. This is data from before the $2 price tax increase. But you'll see that even in these situations, that the average prices in Marin County are about $1.50 more than they were in Stanislaus County. So there's a big difference in pricing. So local communities want to be able to set floor prices with an understanding of what the current pricing market is. And so it's important to be able to understand that on a local level. So as I mentioned, we developed here at UNC this initial model to project outcomes, but the website sort of back-end programming as well as the user interface are currently in development by folks at the California Tobacco Control Program. They've provided really great feedback to our modeling and really good questions at times to make sure that we're representing what would be most useful for folks on the local level. And then we're trying to work closely with them to make sure that sort of the model actually doesn't get lost in translation on its way to the website. So this is something you can be looking forward to coming soon. Then finally, I just want to note that, like any scientific study, there's a lot of limitations to what we've done, but I think some of these limitations also open possible extensions to the type of work that we're doing. So as I mentioned early on, the model we developed applies only to cigarettes. And as Derek described, there's a lot of reasons to think about other products. So one question we might have is just whether or not we can sort of incorporate the possibility that people might switch products. And that's something that there's some recent evidence about that we might be able to add to a model like the one that we did. More complicated, however, would be to actually model little cigar floor prices. And the challenge to that is really that we need to understand in detail sort of how much people consume little cigars and also what they pay, which isn't something that we ask a lot about in many of our studies. But we're looking to see what we might know about this nationally that we might be able to extend to a local context. Second, the model we did focuses only on adults, and therefore, since most people start tobacco use younger than adulthood or very early in adulthood, we're really focused on cessation here. There's a couple of challenges to thinking about youth. And first is that we need information about what youth pay for cigarettes, and there aren't really great data for that. And we know that they often share tobacco or access tobacco products in ways other than buying them themselves. So sort of price data is a little murkier for them. And then second, even if we had this information for cigarettes, cigarettes probably aren't the main target for youth. There's, I think, a lot more concern with e-cigarettes, for example. And as Derek mentioned, figuring out floor price laws for e-cigarettes before we even get to whether or not we can model them, just figuring out the policy itself is very complicated by the sort of variety of products and product components that would go into that. We focused on short-term behavior changes and not on sort of long-term health consequences or cost consequences. And that's partially because sort of the longer you go out to try to predict things, you know that there's a lot of other things that might go on, new policies in places and things like that that would also create an impact. The other reason we know this is because there are actually a lot of studies of tax policies that do this, sort of look at projected longer-term changes. And really what's different about a floor price is how it affects prices, not what happens once prices change to consumption down the line. So our goal was really to think about what would a floor price law do to prices that might be a little different from what a tax does, and then assume that the rest of that sort of when prices change, behavior changes similarly. And then finally, we did a model that applies only to California. We used California-specific data because we really wanted it to be relevant to that context. Can this be done for other states? Absolutely, it could. How specific something could be for a state would really depend on the types of state-specific data that are available. And if there aren't state-specific data, one can substitute national data. It's just always a little bit of a trade-off of sort of how specific it is to the state context versus sort of how good the data are that are available there. But in theory, it's doable elsewhere. So I just want to wrap up with a couple of quick thank yous, especially to the other folks on the UNC team here, as well as to Derek and Pratima for their support from ChangeLab, and then to everybody on a few slides earlier at the California Tobacco Control Program for the work that they're doing to get this launched for public use. And that's it for me.
Great. Thank you, Shelley, for the very informative presentation. We've now come to the Q&A portion of today's webinar. If you haven't already done so, please feel free to type your questions into the chat box. It looks like we only have one question right now, so I'm sure that we can get to all of them. But if you guys submit more questions and we run out of time, we'll be sure to respond by email. So the one question that we did receive is why Prop 56 resulted in some stores in the same city raising Swishers to 2 for $1.49 and other stores continuing to sell them for 99 cents. I can take an initial stab at this, but curious on Shelley if you want to weigh in as well. I don't have an exact answer. My inclination is to say that because OTP taxes are based on a percentage of wholesale costs, it is possible that they are getting it from different wholesalers, or there are different, depending on the quantity and their contracts with those people, that there may be disparities in what the wholesale cost is, and thus disparities in what the applicable tax percentage is to that. I don't know if you have any more insight or more specific insight into why that might be.
I don't know that I think I would probably agree with you. Taxes on other tobacco products, in the same way that sometimes dealing with cigarettes is simple because we already have minimum pack laws, and the sort of products is pretty well contained and defined. And the fact that that's less true with other tobacco products can make the taxation as well as floor prices different. And I agree that sometimes they operate a little bit differently. So I'm not 100% sure, but I would go with your gut there, Derek.
Well, we haven't seen any other questions, so we will close out the webinar. Thank you so much for your time and participation today. Our email addresses were on the previous slide, so if you have any questions, please feel free to reach out. We also hope that you will take the next minute or two to complete our webinar evaluation. It should pop up on your screen after the webinar ends. Thanks so much, and have a great rest of your day and a wonderful weekend.